The whole aspect of cooperative agreements between public and private sector needs to start now.
My name is Vinod. I'm from India, where I belongs to Hyderabad, and we represent QZAP Technologies Private Limited.
My name is Ajay Kumar. I'm from Alenges Medical System.
My name is Benjamin Khotu. I'm the Director of Operation for Sakyu Health Solutions.
My name is Shishir Mishra. I work for Fabtech Technologies International Limited.
My name is Milal Mateu and I'm from company Linet.
People don't know the value of data. So one of the things we are trying to let people know is that the data you have in your clinics is a good thing, is valuable.
No more excuses about this is Africa. We need to be bringing in the highest quality equipment. We need to be establishing the best SOPs, because for the health system, if patients are showing up receiving poor quality dialysis, it's increasing the costs of hospitalization, and it's just putting more of a burden on the health system.
Right now in East Africa, there's a lot of money chasing hospital projects. But these people are not stupid. These are very sophisticated investors who want to see a platform. So number one, have a platform. Even if it's a small platform, build it as a small platform. Have a hospital, have clinics, but have a plan, right? Have something which is bankable.
So why are we losing our health professionals? I go back to quality, it goes back to quality. So first I look at recruitment and retention. From a recruitment standpoint, I think I just want to highlight is we have a grading system, isn't it? So if you get an A, you're automatically sent into the line of a doctor, whether you wanted to be or not. So we're recruiting people in a profession, and maybe some of them don't want to be in a profession. And as a healthcare provider, passion is key.
All these things have to be seriously thought to close the knowledge gap, because we have a lot of quacks who are practicing. You can see that is the example I'm showing in this slide. And these quacks are also a serious patient safety issue.
I was contacted by Verve management, and I saw that the organizers were very passionate on making a difference in engaging stakeholders within Africa. So I thought, being their first attempt to do an event in Kenya, we were gladly willing to support them and speak at the event.
The last 2 days that I saw in the conference, first of all, I really liked the topics that were covered.
I think it was tremendous, because what I found is that the topics that were chosen were very relevant topics. I think the topics all integrated into one simple theme of saying, what are the solutions going forward in healthcare?
It's a very informative forum. We have people from different areas of the healthcare delivery. We have people also who are looking at policy. We have people who are also running other hospitals in different parts of the country, and really for the whole continent.
So the most interesting thing for the summit was the range and diversity of people that came here. And in a way, it's always very useful when you have service providers, you have equipment manufacturers, you have people who've come actually from Uganda as well. So that I find very interesting. That's probably the most interesting thing for me.
Oh no, I think this has been a great conference. I think a conference like this really brings people together from all sides of the value chain, from suppliers to providers, to customers, to patients, to doctors, to government officials.
This Africa Health Summit is very much relevant to our field, because we are manufacturers, and we are meeting to the people who are very much relevant, and they are from healthcare industry. So I can say it is very much relevant, yes.
This event was one of its kind in this region actually. I have not heard of event like this in this region, and it was very very fruitful for us because we got the right audience. There was all decision maker who attended this conclave, and the conferences, the talks what we had was very informative.
Strengthening of the means of implementation.
There is an exhibition like this. Next year we would be really look forward to participate here.
Well, certainly if I'm asked to come, I will be back here.
Definitely. We'll see you there.
Would love to attend next year and listen to more speakers from a diverse background. And then we can be able to sit and exchange ideas. And that's the only way we can be able to strengthen our health delivery system in our continent.